To keep the conversation going, we have a special virtual presentation coming on with Marisa Scala-Foley. She's a director at the Aging and Disability Business Institute at US Aging. She's going to be examining how community-based organizations can adapt to healthcare transformations in Maryland. I think we have her ready to go. Let me know, Marina, if we do. Welcome, Marisa. Thank you.
All right. Thank you so much, Eric. Give me 1 second. I'm going to share my screen so I can get my slides up here for all of you to see. While I am doing that, I am so sorry not to be able to be there with you all today. I hope you have had a fantastic day full of exciting discussions. I've been able to tune in periodically throughout the day, but it was a really exciting agenda, and I hope it's led to some wonderful discussions there in the room. So let me introduce myself. My name is Marisa Scala-Foley, and I direct something called the Aging and Disability Business Institute at US Aging. A little bit about US Aging. We represent and support the national network of area agencies on aging around the country. There are more than 600 area agencies on aging around the country. We also advocate for what are called Title VI, which refers to the Older Americans Act, Native American aging programs, all of which help older adults, people with disabilities, and caregivers live with optimal health, well-being, independence, and dignity in their homes and communities. So if you're not familiar with area agencies on aging, they were formally established under the Older Americans Act in 1973, and they are a portion of the aging network, the on-the-ground organizations that are charged with helping older adults, again, to live with independence and dignity in their homes and communities. They have served as local leaders on aging for more than 50 years, and they are really charged with planning, developing, funding, and implementing local systems of care and coordinating those systems for older adults, in many cases, people with disabilities, and caregivers with regard to home and community-based services in what are called planning and service areas. In some situations, planning and service areas for area agencies on aging might be a city, like in Baltimore. In Maryland, it might be a county. It might be a group of counties. It really depends on how a particular state has kind of carved up the regions within their states that area agencies on aging address. So about us at the Business Institute, our mission is really all about what today has been about for all of you there at Bloomingday, Maryland, in that we are designed to help to build and strengthen partnerships and contracts between community-based organizations, as well as networks of community-based organizations and the healthcare system, so that people get the right care in the right place at the right time and can live in their homes and communities for as long as possible. So we are funded by the Administration for Community Living, the John A. Hartford Foundation, the Health Foundation for Western and Central New York, RRF Foundation for Aging, and the Margaret A. Cardinal Philanthropies for the work that we do every day. And what is that work? We at the heart of what we do is training and technical assistance. Our audience is community-based organizations, whether those are area agencies on aging, centers for independent living, or other kinds of aging and disability service providers. We also networks of community-based organizations, which may be led by what are called community care hubs, which I'll get to talking about in a minute. But we do resource development. We have a very robust website where you can find all kinds of materials, from resource guides to case studies to success stories that can help you on your healthcare contracting journey. We do information gathering through periodic surveys to gauge the extent to which community-based organizations are, in fact, contracting with healthcare organizations, whether those are health plans, health systems, accountable care organizations, and on through the sort of alphabet soup of healthcare payers and providers that are out there. We provide thought leadership at the national level on the value that community-based organizations can bring to healthcare organizations and why they should work together. to address the whole person health needs of older adults, people with disabilities, caregivers, and other populations that have complex care needs. And then finally, we are the home of what is called the Center of Excellence to Align Health and Social Care, which funds and provides technical assistance to community care hubs, which are administrative backbone organizations for networks of community-based organizations that are seeking to contract with healthcare providers and payers. So I'm going to share a little bit. I mentioned we do information gathering. I'm going to spend some of my time with you all today talking a little bit about what the data tells us about the extent to which community-based organizations and healthcare organizations are contracting with each other and the kinds of services that are offered under those contracts. It is our belief at the Business Institute that if community-based organizations are helping healthcare organizations to achieve better health outcomes on behalf of the people they serve, that they should be paid for those services. Hence our emphasis on contracting. So a little bit, we sort of cut to the punchline right away when we talk about this data that we gather. And I should mention that our research partner in all of this is Scripps Gerontology Center at Miami University. They have been a longtime partner of ours on these surveys, as well as on other kinds of research and evaluation work that we do at the Aging and Disability Business Institute. So at the heart of this survey that we do, and we have now done 5 of them, and we'll go into the field with our 6th survey in early 2026. At the heart of this survey is the question of whether or not a community-based organization is contracting with a healthcare provider or payer. And again, that could be a health plan, a health system, and more. And we'll get at some of those common healthcare partners in a minute. And the good news, I would say, in all of this is that contracting continues to grow between community-based organizations and healthcare organizations. So it's growing slowly, but it is growing. When we first started doing this survey in 2017, about 38% of the responding community-based organizations indicated that they had 1 or more contracts with healthcare organizations. By our last survey, which was in 2023, that had grown to 47%, indicating that they were contracting with a healthcare organization, which is statistically significant growth for the researchers there in the room. And my favorite statistic in all of this is that not only are community-based organizations getting contracts with healthcare organizations, they are keeping those contracts. And you see in the circle at the upper right-hand side of the screen that 86% of CBOs with contracts indicated that they had had a contract renewed by one of their healthcare partners, which is fantastic. So I mentioned we talk about who the common healthcare partners were for CBOs with contracts. Not surprisingly, at the top of the list, because Medicaid really gets more of what community-based organizations do when it comes to home and community-based services. You know, at the top of the list are Medicaid managed care plans, also in the top 5 are state Medicaid agencies in states where there isn't presently managed long-term services and supports. Also hospitals and healthcare systems, VA medical centers, and commercial and employer-sponsored plans. We've seen contracting trends. We've seen some growth with particular partners over time for community-based organizations. With Medicaid managed care plans, as you can see, the blue bars on your screen represent our first survey, and the purple bars represent the last survey that we did in 2023. And all of these, again, represent statistically significant growth. So we see contracting has increased over time between CBOs and Medicaid managed care plans, between CBOs and Medicare Advantage plans, which, you know, in large part has to do with the Chronic Care Act and the expansion of supplemental benefits that Medicare Advantage plans are able to offer to their members, which can target different kinds of home and community-based services and social needs, as along with a variety of other kinds of services along those lines. We've also seen increases in contracting between community-based organizations and accountable care organizations. And then finally, we've seen an increase in terms of the number of community-based organizations that indicated that they are providing services through Medicare fee and are getting paid by Medicare fee-for-service, whether they themselves are Medicare Part B providers or are working with a physician practice or a health system that bills Medicare on their behalf for Part B services that they are able to provide. So what kinds of services are they delivering, are CBOs delivering under contract? At the top of the list, as it has been since we started doing this survey, are services that we kind of lump together as care management, care coordination, service coordination, with 57% of contracting CBOs indicating that they were providing care management or care coordination under at least one of their contracts. Assessments are up there, as you can see, whether those are assessments for so what we've been calling social determinants of health, and which the Centers for Medicare and Medicaid Services are now beginning to call upstream drivers of health. Things like food security, affordable housing, transportation, all the kinds of things that you've been talking about today there in the room. Person-centered planning is also up there when it comes to one of the most common services provided under contract, as well as home care and nutrition programs. And again, a little bit of trend data here, and again, a reminder, purple bar is 2023, our most recent survey, blue bars are 2017. We've seen statistically significant increases in a number of services provided under contract: person-centered planning, home care, nutrition programs, transportation, participant-directed care, and caregiver support. Caregiver support, I've long felt, has sort of been like the sleeper service when it comes to what CBOs are providing under contract. And as health plans and health systems have continued to get to know their membership and their patients, whatever they call the people whom they serve, we have seen growth in terms of an increase in the provision of caregiver support, training, or engagement related services under these contracts between community-based organizations and the healthcare organizations. In large part also due to some of the emphasis placed on caregiving under the last administration. So I mentioned I would talk a little bit about what are called community care hubs, as that's been a newer trend that we have seen when it comes to contracting between community-based organizations and healthcare organizations. Often what we see when it comes to contracting is that healthcare organizations, and in particular health plans, don't necessarily want to contract with dozens or hundreds of community-based organizations in a given state or in a given catchment area within a state, if you're in a larger state. And so we've seen the growth of what are called of networks of community-based organizations, which are often led by what are called community care hubs. And these are nonprofit organizations that, again, as I mentioned before, are that administrative backbone that support contracting efforts between healthcare organizations and a network of community-based organizations. They centralize the administrative functions and operational infrastructure that are needed in order to for networks to be more efficient, to provide standardization when it comes to the kinds of services that they provide, ensure compliance, and to help to manage performance and really drive quality when it comes to supporting whole person services. So we've seen growth in this area as well. A growing number of community-based organizations are achieving their contracts through networks that are led by community-based, or that are led by community care hubs. When we first started doing this survey in 2017, about 20% of CBOs with contracts indicated that at least one of their contracts was through a network of community-based organizations. And then by 2023, that was up to, that had almost doubled to 36% of CBOs with contracts. So we did a little digging under the hood of what these community care hubs look like. Some of them, about a third, their sole purpose is to serve as a community care hub. About half are a community care hub and also an area agency on aging. And another 20% are a community care hub as well as another kind of community-based organization. So the community care hub is either an arm or sort of a division within a larger organization. And about 64% fund their administrative functions that the community care hub provides through their healthcare contracts. All right, so I want to spend the last few minutes that I have with you all talking about what we have seen when it comes to both challenges and opportunities when it comes to contracting between community-based organizations and healthcare organizations, really forming those cross-sector partnerships that have been at the heart of your discussion today. So one of the things that we ask in our survey is really about the most common contracting challenges, both when it comes to achieving or establishing the contract, as well as contracts that may persist during the contracting relationship as contracts are being implemented. And you can see some of these challenges here on the screen. When it comes to establishing the contract, none of this will probably surprise you. Negotiation of pricing or contract terms is up there at the top of the list. A lack of awareness by healthcare organizations of the kinds of services and programs that community-based organizations can offer, the time it takes to establish a contract, achieving a common understanding of proposed programs or services. State program policy factors into some of the challenges that when it comes to establishing a contract, and then referrals and volume. And we see referrals and volume sort of on the right side too, when it comes to the challenges that persist during the contracting relationship. Referrals and volume, staff turnover within the healthcare entity or within the community-based organization. And then, you might be a little bit surprised by the sort of negotiation of price and contract terms, because you'd figure that would be more of a challenge when it comes to establishing the contract. And why it appears in this category as well is we've heard anecdotally from community-based organizations with contracts that often there is what is called scope creep, right, when it comes to these contracts. So, the contract is for one thing, but maybe additional services might get sort of added on without an accompanying renegotiation of price or contract terms. So we believe that's why we see that here as well. Some other kinds of challenges that community-based organizations have reported when they are, under their contracts when they're working with healthcare. And first is, and I'll bet this has come up in some of your earlier sessions today, we are talking about when it comes to healthcare, the alignment of health and social care, we're talking about bridging what has typically been two historically separate ecosystems with their own language about services and so forth. So, often it is a challenge to really bridge that gap between the two, to speak a common language, to find those champions within either system who really get what the other system kind of offers and the kinds of challenges that they're dealing with. There are also, as you might imagine, unbalanced power dynamics. Healthcare has far more dollars going into the system. If you look at, and I speak because my history and my background is in the field of aging. If you look at the dollars at the federal level that go toward the Older Americans Act, it has been, with the exception of, dollars that flowed into the system during the pandemic under ARPA, the American Rescue Plan Act, Older Americans Act dollars have been largely flat for a long time and have nowhere kept pace with the growth of the older population. But if you look at sort of the trajectory of growth and the dollars that have flowed into Medicare and Medicaid, they are off the charts compared to what goes into the Older Americans Act. So they're off with those dollars often come, some unequal power dynamics when it comes to establishing these contracts and so forth. Other challenges include building the right kinds of incentives, smart incentives for the systems to work with each other and understanding what works and doesn't work when it comes to these contracts. Developing shared data systems and interoperability has been a huge challenge, and I know has been the subject of what you've been talking about today and what systems like Blooming Health are designed to help with. Identifying opportunities to leverage and scale across regions within or within a state or across states. And then finally, ensuring, when it comes to community-based organizations, ensuring that they have support from state agencies, whether those are state Medicaid agencies, state units on aging, or other kinds of state agencies for their contracting work. And the reason why this is so important and why this alignment is so important, is that social care and social care providers really bring their own particular body of expertise and strengths when it comes to addressing whole person health needs. They are often the missing link when it comes to whole person care, because we've all probably seen that statistic that sort of 80% of health outcomes are driven by, what's beyond the hospital or the clinic or the physician practice walls. Social care providers are trusted resources with long histories within their communities. They are experienced in providing robust person-centered assessments to ensure that it's not only, the need for meals or the need for transportation that gets addressed, but really that person's holistic needs, right? Because often if someone needs a meal, they often may need a variety of other kinds of services as well. Social care providers are also expert at navigating that complex landscape of services and in what's called braiding and blending of different kinds of programs, that have different eligibility requirements and different funding streams. And then finally, they can really contribute to positive whole person health outcomes and lower cost of care through the provision of the kinds of services that they offer, whether it's related to housing assistance, nutrition, transportation, and more. And then finally, this is just how you can connect with us. We invite you to connect with us at the Business Institute and to learn more about our Center of Excellence to align health and social care, and certainly to stay connected with us through our newsletter. And with that, I will turn things back over to Eric for Q&A.
Great. Thank you so much, Marisa. I'm curious if anyone has any questions while we still have her. Oh, sorry. Yep. Thanks, Kavitha.
Hi, thank you very much for your presentation. I was just wondering if you could list if there are any community care hubs in Maryland, and if so, how did they come about gaining that status?
Yeah, that's a great question. I'm sorry, was there more to that question? I apologize if I cut you off.
Nope, you're good to go. Okay,
great. We have worked with two community care hubs in Maryland. First is through MAC, Maintaining Active Citizens, which is on the Eastern Shore of Maryland. They are a community care hub out there on the Eastern Shore, and have worked, I know, with area agencies on aging and other community-based organizations throughout the state. They have done a lot of work on evidence-based health promotion programs, as well as on social connection related work. They have also worked with CRISP in Maryland, your Health Information Exchange. And so that is one. The other organization, and I'm going to just confirm, I believe it is called, Totally Linking Care, I believe. I'm going to confirm that. And they have been part of a national learning community that we have done with community care hubs throughout the country. So those are the two that I know of. I'm going to confirm that name to make sure I didn't get it wrong, of the second community care hub. At this point in time, there is not a particular sort of designation. Yeah, and I was right. It is Totally Linking Care in Maryland. If you go to our website, you will find information about our Center of Excellence to align health and social care. And you can find information about some of these community care hubs in Maryland that we have worked with. As I was saying, there isn't a particular designation or certification yet at this point for community care hubs. It is really, they have largely kind of developed organically within communities and states where organizations have seen a need and formed these networks of CBOs. And we have a host of resources for those interested in learning more about community care hubs or perhaps becoming one yourself, your organization becoming one as well. We have a lot of information about this, both on the Business Institute website, as well as on the website for our Center of Excellence to Align Health and Social Care, including a 101 webinar series on community care hubs, as well as a catalog of resources designed for organizations that are interested in becoming CCHs themselves.
Thank you so much. Are there any other questions while we have her? All right. Marisa, thank you so much. What a great, wonderful treat to have you with us today.
All
So,
right.
round of
Thank you so
applause. Thank
much.
you. Thank you, Marisa. That was wonderful.